When it comes to hormone optimization and preventative care, the insurance system has limitations. And here is something nobody tells patients. The way your insurance company defines normal and the way your body defines normal are not always the same thing. And to be clear, insurance-based medicine is incredibly important. And there's room for insurance when it comes to emergency visits, cancer treatment, surgeries, chronic disease management. That system saves lives every day, but it's not ideal for those that are looking for optimal health. Insurance medicine versus optimization medicine. One of the biggest difference patients need to understand in this is insurance-based medicine is usually built around guidelines designed to diagnose and treat disease. Optimization focused care is often focused on improving symptoms, quality of life, function, and prevention before someone becomes severely abnormal. And that is the true difference between optimization and insurance-based care. Insurance companies rely heavily on strict diagnostic criteria because they need something measurable, thresholds for coverage. So many patients have to become abnormal enough on paper before treatment even gets started. But there is a massive gray zone in between. The patient who technically falls inside that lab range may still feel exhausted, struggles with libido, brain fog, gains weight easily, has poor recovery, or simply just does not feel like themselves anymore. And that gray zone is where a lot of patients live. And so often we debate older guidelines versus newer research and evolving clinical practice. Medicine evolves every day. Things change. Keeping up with the system is where the gray zone is, truly. Years ago, testosterone conversations were mostly, is the number below the cutoff? And now we understand things are much more nuanced. Free testosterone matters. SHBG matters. Symptoms matter. Sleep matters. Metabolic health matters. Insulin resistant matters. The same thing is happening in women's hormone health and thyroid disease. We're learning more about individualized hormone set points, symptom-based care, menopause, metabolic dysfunction, perimenopause, and the limitations and the broad reference ranges on these populations is what limits the care in insurance medicine. The system is built around disease and not optimization. So traditional insurance-based medicine is mostly designed to treat diagnostic disease. I know this sounds repetitive, but meaning the system is reactive by design. It usually wants and waits until something clearly breaks before it allows providers to actually intervene. So if someone walks in exhausted, gaining weight, low libido, brain fog, inflamed, anxious, sleeping poorly, right? I could go on. Their labs technically fall inside a reference range, but they're often told, oh, well, you're fine. You'll be okay. You're just in menopause. You're just getting older. You're not sick enough yet, right? And that does not automatically mean healthy. There's a huge gray zone between optimal health and full disease. And a lot of patients live in that gray zone for years. And that does not mean everybody needs medication, but it does mean people deserve a deeper evaluation instead of immediate dismissal. If you feel dismissed or experience any of these symptoms like many others do, you owe it to yourself to get evaluated. Why wait until it's too late or to meet those unrealistic thresholds? You don't have to wait. Testosterone hormone coverage is complicated. I get it. Hormone therapy can honestly be all over the place. Sometimes insurance wants to cover it. Sometimes it partially covers it. Most of the time it denies it completely because it's not considered a medical necessity. And even when insurance approves treatment initially, coverage can change later and suddenly stop. And that creates a lot of frustration for patients, especially because most insurance companies do not consider hormone optimization or preventative hormone care medical necessity unless someone meets that very strict criteria. And so many patients end up in the awkward middle ground, symptomatic, struggling, but not abnormal enough for coverage. And this applies to women too, not just men. The cost difference is huge. I get it. Honestly, this is one of the biggest misconceptions I see. A lot of people think my insurance should cover hormones. And while I still believe that should be true, in reality, that doesn't always happen. And sometimes it does. But many insurance plans do not consider hormone optimization or preventative hormone care a medical necessity unless someone meets a very strict criteria that's not realistic. And so depending on deductible deductibles, coverages, the type of insurance, what labs are ordered, patients can get surprised with a very expensive lab bill, even medication sometimes, even into the thousands of dollars at times. And that is one reason Vital Forge Wellness, we negotiate direct cash pay prices with labs to help make hormone evaluations more affordable and accessible for patients. And honestly, I understand why patients get frustrated because people are paying into insurance, and naturally, you would expect those services to be covered. But hormone coverage is one of the most inconsistent areas in medicine right now, and it is one of the biggest gaps in our medical care, unfortunately. Thyroid insurance can limit options too. Thyroid care runs into similar problems. Most patients do very well on levothyroxine. It's inexpensive, effective, and covered by almost every insurance plan. But research consistently shows that 10 to 15% of patients still have symptoms despite having a normal TSH, which is your thyroid hormone lab that we monitor. And you can still have those symptoms: fatigue, brain fog, depression, weight struggles, hair changes, feeling flat. And for some patients, sometimes T4 and T3 therapy can help. But T3 medications are often more expensive, not always covered by insurance formularies. So now access can become influenced by insurance, what they dictate, what they restrict. And you have this patient actually sitting in front of you trying to optimize their medication. Even endocrine organizations now acknowledge that combination therapy can be considered in carefully selected patients a great benefit to their therapy, but guidelines and insurance formularies do not always meet eye to eye or at the same speed. Women's hormones. The bigger problem is access. For women, it gets even more complicated. Some hormone therapies are covered, some are not. Some require prior authorization. Coverage varies widely depending on the plan. And honestly, one of the biggest problem is that many women never even get that conversation. They are often told it's just aging, that's normal, welcome to menopause. Meanwhile, they are struggling with anxiety, that's sleep deprivation, brain fog, hot flashes, mood swings, and low libido. Honestly, one of the biggest limitations in insurance-based medication is time. Most primary care visits are incredibly short, system-driven care, not enough appointments open to see patients. Providers are trying to manage chronic diseases, address acute concerns, review medications, handle documentation, and meet billing requirements. All inside is a very limited appointment. There is often no time to spend 30 to 60 minutes discussing your sleep, your stress, your nutrition, your body composition, your labs, what stage of life you're in, whether it's andropause, perimenopause, postmenopause. That is not provider failing. That is the system limitation. And that is where optimized focused care tries to go deeper and not replace traditional medicine, but to fill the gaps where patients often feel unheard. So let's have that tough conversation for a minute. Health care and health insurance are not the same thing. Healthcare is about helping people get healthier, and insurance is a business model designed to manage risk and control costs. Those goals don't always align. Insurance companies don't get paid more because you feel better. They get paid by deciding what they will and won't cover. And that's why many preventative treatments, including hormone therapies, obesity treatments, nutritional counseling, and wellness services are often denied, restricted, or even considered not medical necessity. Not because your symptoms aren't real and not because the treatment can't help, but because someone has decided it doesn't meet that coverage criteria. And as providers, we often spend hours fighting prior authorizations, writing appeals, and trying to justify care we believe that is already appropriate for you. And meanwhile, patients are left frustrated. They're waiting, wondering why nobody is helping them. The reality is that healthcare should be about outcomes, quality of life, and preventing disease before it happens. And unfortunately, the system often pays more for treating disease than preventing it. And that's why at Vital Forge Wellness, we focus on patients in front of us, not by the insurance dictating what matters best for the patient, but because your symptoms do matter and your quality of life does matter, and you deserve a conversation that goes beyond a billing code. Why expertise matters more in hormone care. So hormone care is nuanced. This is not like treating strep throat where you usually get one clear answer. Hormones are interconnected. It's not just a total testosterone or a total estradiol or total progesterone. What are you even chasing, right? And hormones are interconnected in the way that symptoms matter. And that will all affect each other in a nutshell. So this is why expertise matters. You're choosing a hormone provider is like kind of choosing a mechanic for a high performance car. If you check your engine light is on and you do not want someone just clearing that code, right, and sending you home, you want somebody who's actually going to look at the entire system and knows how to figure out why the problem is happening in the first place. Otherwise, you're just going to keep coming back and that light is just going to keep switching off and you're going to feel frustrated. You're going to feel like you haven't been heard. I try to provide a safe place for you to kind of open up about your experience. The big part of hormone specializing in is it's never linear. There's so many avenues you can go, and not every person is the same avenue on the same path of life. At Vital Forge Wellness, we focus on comprehensive evaluations, individualized lab interpretation. Symptom tracking is super important as you optimize your hormones, education, and shared decision making. I like to emphasize that, as providers, it's our job to guide you on your path to hormones, not to tell you how to optimize your hormones, but to give you the option so that you understand what route you want in life. Is it quality of life? At Vital Forge Wellness, we try to provide a judgment-free zone. It allows you to discuss everything you're feeling, whether you feel like you're crazy or not. We're here to guide you. As a provider, I think it's really important that it's not telling you what you have to do to get to X, Y, and Z. The goal is to educate you and know where you are at in your life, what options you have. And that matters the most because hormone optimization is not about chasing numbers. So depending on what your goal is in your hormone journey or weight loss journey and the quality of life that you want to drive yourself to be a better version of you, we're here to guide you through that. And I think that's the biggest important thing about providers, that shared decision making to make you feel confident in your care and feel like you're not in a judgment zone. And at Vital Forge Wellness, that's what we focus on. It's about understanding the whole patient. Treating numbers versus treating the patient. So if your provider is only treating your lab numbers and not your symptoms, you're really not being treated. Two people can have the exact lab result, right? But they feel completely different. One person sleeps well, low stress, exercises feel great for them. But another person has poor sleep, insulin resistance, chronic stress, inflammation, and just feels awful. Same number, completely different story. This is why medicine cannot be so robotic. Symptoms matter, history matters, lifestyle matters, and follow-up labs matter. Your hormones have a chain of command. Your hormones work like a company. Your brain is the CEO. The hypothalamus reads what's going on in your body. The sleep, the stress, the nutrition, the inflammation, the body fat, and energy levels. And then it sends that signal to the pituitary gland. So it goes brain signal to the pituitary gland to your hormone production. If your brain is not sending that signal, it messes with the hormone production. That simple. And just like a thermostat, your body gives feedback. So when hormone levels are high enough, the brain slows that signal down. But if your body is under stress, poor sleep, chronic dieting, obesity, inflammation, or even high stress, the brain may pull that back. That means that gland may not be broken. It's just not getting the message. Lifestyle can change the signal. This is not just eat better, sleep more advice. Lifestyle can literally change hormone signaling. Research has shown sleep deprivation can lower testosterone in the morning. Stress, severe calorie restriction, and poor sleep means that the brain sends fewer signals to make hormones. Obesity can lower that testosterone significantly. UK Biobank data show that increasing that BMI from 25 to 40 had a much larger impact on testosterone than aging alone. And insulin resistance can lower your SHBG, which makes the total testosterone look lower on the lab. So if nobody asks about sleep, stress, nutrition, insulin resistance, body composition, they're not doing a full hormone evaluation. They are just reviewing a lab. One lab is not the whole story. A single lab draw is a snapshot. It's not the full movie. And this is why follow-up labs matter. And whenever possible, using the same lab, different labs and assays can create different results. We are not just chasing a number, we are tracking your trends. Normal does not always mean optimize. Thyroid works through a similar chain of command. The brain tells the pituitary to release that thyroid hormone. Then the thyroid makes the hormone. So basically, it's measuring how loudly the brain is asking for your thyroid to work. And a high TSH means we need more, and a low TSH means to slow down. Most people do well on levothyroxine, but research shows that 10 to 15% of people have symptoms even when they're considered normal. A 2024 Lancet review was also discussed that people may have their own individual thyroid set point. So even if a TSH of 3.8 may be normal on paper, but if that person functions better closer to 1.2, they might still have those hypothyroid symptoms. That is why some guidelines support optimizing TSH into a tighter range for symptomatic patients instead of just saying you're in range and you're fine. A lot of combination therapy for T4 and T3 has been shown in some research that patients prefer it more than just T4 alone, which is your levothyroxine. That does not mean everybody needs to be on it, but it does mean symptoms still matter. That's the bigger picture. Testosterone, the number alone, is not the diagnosis. The Endocrine Society made that clear. Testosterone deficiency requires symptoms plus consistently low levels. It's not just a number. Symptoms matter. A man can have fatigue, low libido, brain fog, weight gain, and low motivation, and his total testosterone is 310. That lab calls it normal, but that does not mean it's optimized or normal. We should really steer away from saying normal and really focus on the whole patient, especially if nobody checked a free testosterone, metabolic markers, we're missing the whole picture. So when testosterone therapy is appropriate, the benefits can be meaningful. The Traverse trial followed more than 5,000 high-risk men for almost 3 years and did not show an increase in heart attack, stroke, or cardiovascular death. Monitoring still matters because no therapy is risk-free. In women, treat the symptoms, not just a lab. In women, hormones are even harder to capture. They fluctuate through the cycle. During perimenopause, those symptoms and signals become unpredictable. Like I said, it's like the chaos before the storm hits. One day estrogen is up here, the next day it's down here. And that is why women can still feel awful, but their labs look normal. We should really steer away from saying normal. You are catching one snapshot of a moving target. So when a woman has hot flashes, insomnia, anxiety, mood changes, brain fog, low libido, and weight changes, we have to listen. That number does not matter if the woman is very symptomatic because the patient matters more. And ACOG and endocrine guidance both support dosing hormone therapy based on symptom relief, not just chasing a serum lab value. Testosterone. Think of testosterone as the engine of a man's body, right? It's not just sex. It's, it's his energy levels when he wakes up in the morning. It's his drive when he wants to tackle projects. It's his motivation to go to the gym. It's his ability to go build muscle and maintain it. It's his confidence and sense of well-being. So when that starts to decline, many men don't just come into the office saying, I think my testosterone's low. They say, I'm tired. I don't have the energy that I used to. I'm gaining weight around my stomach. My workouts aren't just working anymore. My sex drive is gone. I just don't feel like myself. That's the engine trying to run on an empty tank. Estradiol. So let's talk about estradiol. Most men don't realize they have estrogen, but they do. In fact, your body converts some testosterone into estradiol naturally. That's normal biology. Estradiol plays an important role in your bone health, brain function, libido, and erectile function. One of the biggest myths that I hear is estrogen is the enemy. It's not. The goal isn't to drive that estradiol to zero. And contrary to what some people think, we don't typically chase those numbers. We treat the patient. Remember, the labs are part of the story, not the whole story. The goal is balance. And when testosterone and estradiol are working together the way that they're supposed to, that's when men tend to feel their best. And then there's progesterone. Progesterone, most people think it's only a female hormone. Guess what? Men make it too. Think of progesterone as the supporting cast. It helps to support your mood, your sleep, your brain function, and it serves as a building block for hormones. It's not usually the star of the show in men's hormones health, but it plays an important part of the hormonal orchestra. I tell my patients to think of hormones like a three-piece band. Testosterone is the lead singer, estradiol is the drummer keeping everything in rhythm, and progesterone is the bass player holding everything together in the background. When the one member is off, the whole band sounds terrible. The goal isn't to force or focus on one hormone. The goal is creating harmony. Bottom line, your hormones run through a chain of command, brain to pituitary, pituitary to gland, gland to hormone production. If we only look at the final number and ignore the signal, the symptoms, the lifestyle, the history, and the follow-up labs, we miss the big picture. And sometimes you do not have a hormone problem. You have a diagnostic problem. A reference range is not a treatment plan. Medicine should treat people, not just lab flags. And that's why Vital Forge Wellness exists, not to sell you something, not to convince you that you need a treatment, but because I am passionate about helping people become the healthiest versions of themselves. We believe you deserve the best, or to be heard, or symptoms that deserve a conversation. And we believe healthcare should be about understanding the whole person, not just checking a box or reviewing a lab value. Whether the answer is hormones, weight loss, lifestyle changes, or just simply reassurance that you're on the right track, our goal is the same: to help you find answers, understand your body, feel your best, because you deserve more than a quick dismissal. You deserve a provider who listens.